Wealthy countries and pharmaceutical companies have been accused of breaking their promises to donate COVID-19 vaccines to poorer nations. A new report by the People's Vaccine Alliance says only 1 in 7 vaccine doses pledged to the world's poorest countries have been delivered. Meanwhile, developed economies like the US and Europe are on track for a full recovery from the pandemic this year. That's because they purchased far more injections than they needed to fully inoculate their populations. Paolo Montesilio has the details.
10 months after the rollout of the first COVID-19 vaccines in Europe and the US, the East African nation of Burundi is just starting its inoculation drive.
I'm among those who will go to get vaccinated because this vaccine is very important for our health.
If we receive this vaccine, there will be fewer deaths from the coronavirus. I'm ready to get the shot.
This leaves Eritrea as the only African country that hasn't started vaccinating its population against COVID-19. The slow distribution of vaccines is prolonging the pandemic in poor nations. And according to the People's Vaccine Alliance, a movement of health and humanitarian organizations, developed economies and drug firms are to blame. In a report, the group says that of the 1.8 billion doses rich countries promised to donate, only 14% have been received. Western pharmaceutical companies are doing even worse, delivering only 12% of the 1 billion doses they pledged to COVAX, the UN-backed effort to inoculate middle and low-income countries. Vaccine makers and their governments have also refused to sign off on patent waivers that would allow emerging economies to manufacture their own shots. The European Union says it's pulling its weight, even though members like France and Germany have fallen short of their commitments.
The European Union is doing its part. On top of our experts, we will donate at least 500 million doses of vaccines to the most vulnerable countries. But we know that other countries also have to step up.
The People's Vaccine Alliance is calling on rich governments to make good on their donations. It also wants drug firms to waive intellectual property rights and sacrifice their bottom lines to help countries still struggling on the front lines. Paolo Montesilio, TRT World.
Let's get more on this now with Maaza Seyoum, who joins us from Boston, Massachusetts. She is African Coordinator of the People's Vaccine Alliance and Partnerships Lead of the African Alliance. Welcome to the program, Maaza. Thanks so much for joining us. So your report shows that wealthy nations and pharmaceutical companies are falling very short of their promises to deliver these vaccines to poorer countries. Can you tell us just how far short of those deliveries have been and who's responsible exactly?
Well, thank you. I would say that there have been failures on several fronts. Firstly, many rich countries have committed to donating many doses. I saw the clip that you just played of the European Union committing to donate doses. To date, 1.8 billion COVID vaccine donations have been promised by the G7 and the European Union, but only 14% of those have been delivered. I would say the other failure is from COVAX. That's the international mechanism that was set up to deliver vaccines to low and middle income countries. It has failed to live up to its commitments. They have admitted that. This is because of another broken promise. The Western pharmaceutical companies, AstraZeneca, Pfizer, Johnson & Johnson, and Moderna, have only delivered 12% of the doses that they had committed to COVAX. And this is because they're prioritizing selling vaccines to rich countries in order to increase their profits. So they have left COVAX to flail, and they have left people in low and middle income countries to die.
Tell us more about the situation in Africa, because we know South Africa has been spearheading an initiative to waive COVID-19 vaccine patents so that production can be seriously ramped up on the continent. Is there any progress on that front?
Well, I would say just generally about Africa, first of all, that Africa is unfortunately bearing the brunt of what we at the People's Vaccine Alliance and at the African Alliance are calling vaccine apartheid. To date, only 5% of people in Africa have been vaccinated against COVID-19. This while the majority of people in rich countries have been vaccinated. 10 countries in Africa, including my own country of Ethiopia, have vaccinated fewer than 1% of the population. So you can imagine what that means when fewer than 1% of the population has been vaccinated. Elderly people, people living with comorbidities, as well as health workers, nurses, doctors have not been vaccinated. You mentioned the TRIPS waiver. That is the waiver proposed by South Africa and India to waive intellectual property rights on COVID-19 vaccines. This would allow companies around the world to make their own doses. There are manufacturers ready in Africa, in Asia, across Latin America to make their own doses. This TRIPS waiver has been blocked by the European Union and other powerful countries at the World Trade Organization. This, of course, is because of pressure from pharmaceutical companies who do not want those intellectual property rights to be waived, so they can keep, holding on to the manufacturing capability on their own and make more money from these vaccines. So the People's Vaccine Alliance is really hoping that this TRIPS waiver, which has been put into the World Trade Organization by South Africa and India, and that has been supported by 100 other countries around the world, can be put on the table at the G20 meeting that is coming up next week.
So there really is still a very long way to go in terms of vaccine access, isn't there? Maaza Seyoum, we will have to leave it there, but thank you again for joining us. And that is the latest business and finance news for now.